So my name's Mike Woodward. I'm the head of nursing for infection prevention control at the Countess of Chester Hospital. I've worked at the trust since 2000 and been in IPC since 2008. So in terms of the MEG audit tool, really, we had a very archaic system of audit prior to adopting this, 2-3 years ago now. It was very much a paper-based audit process. We did have some very ancient old little software that we would input our audit tools in, our audit reports into. We have to come back and download onto the computer, and there was a lot of manual typing up of any content, any narrative around the audit. And then if you wanted to add any illustrations, pictures, you'd have to take them on your phone and then email. It was a very time-consuming process to do the audit and then to disseminate the results out. People would just email people individually, and nobody would have that broader view of the audit findings and any themes or trends, etc. So yeah, it was very behind the times in terms of how we were delivering our audit program. And then moving on to MEG, my predecessor had used it in another hospital and suggested bringing it in. So it took a while to get the approval, but once it was brought in, it's basically revolutionised how we deliver our audit program. In terms of the time it saves as well, the slickness of the audit process. We can go out and do an audit, and then the report is disseminated immediately to the audit area. It's got the visuals on there on the action plan, and then we've broadened out who can have access to the dashboards as well. So at the moment we've got over 80 members of staff in the trust, ward managers, matrons, heads of nursing, who've all got access to the dashboard, so they can see clearly their audit data. They don't have to contact us to see that. So yeah, it's kind of just revolutionised how we deliver our program, but how we share that with other people as well. And the more people that are having access, that's kind of having a snowball effect, and so more and more people want to have access to the MEG dashboard as well, to be able to see what the audit data looks like, to look at the themes and trends. So it's and it's really it's of such value at the moment, because we're the monitoring of the practices we're doing. We are seeing some gaps in assurance in relation to IPC practices. So there's a real focus from our executive team on what the outcome of our audits are. So it's integral to how we deliver provide our assurances in relation to the care that's being delivered at the moment. So it's we couldn't function without it now. I don't know how we functioned before we had it, really. So yeah, so I'd say I'm the head of nursing for IPC at the Countess of Chester Hospital. So I have overall responsibility and sort of the strategic lead for IPC at the trust, and I manage the IPC team as well with my matron, who kind of leads the operational side of the team, and I'm also I have overlap with the strategic and with the operational delivery. And having the MEG audit tool helps us monitor the delivery of our strategy, but also measure our standards of care that we're delivering operationally. So it's integral to what we're doing in terms of providing assurance. And as I say, before we had the MEG tool, we had a very time-consuming audit, paper-based process. So it pays for itself in terms of the time that it's freed up and the efficiency in illustrating and showcasing our audit program, and I'd say sharing the visibility of our audit data with the wider organisation. I couldn't think of the name of it, but I remember it now. It was called an iPack, and it was a little handheld electronic docking thing, and it had the IPS audit tool on there. But the software that it used to sync with on our PCs became redundant. It wouldn't update anymore. So we could go around and do the audit on there, but then we'd have to come back to the office and then manually input the audit results there, manually type in any narrative, manually upload any photographs from the audit, and then email that audit results out to the relevant people. So that was one of the big challenges that we had, really. And then strangely, when we brought Meg in at the same time, elsewhere in the organisation, they brought in Tendable, the audit software data. So we've had two software data running side by side for the last couple of years, and straight away you've got that comparative between Meg and Tendable, and there's no comparison really. It's Meg's so much easier and slicker to use, and our actual subscription to Tendable expires this summer, so some of my colleagues in the quality team are evaluating both programs, and definitely advocates of the Meg's audit system. So it's something that I'll definitely be championing. Yeah, we were very much looking to make the whole audit process a lot slicker and save time, and so that rather than complete the audit and then have to go back to the office and type the audit up and send it out, we wanted to complete the audit and press done, and then the results go to the relevant people there and then. So that's one of the crucial things, because it saved that time and it freed us up then to be able to expand on what else we do in terms of driving improvements in relation to IPC. So it's very much a time thing, but it was also the usability of it as well, because obviously there's different audit tools out there, but where Meg fits in really well with us is the dashboard is really great to navigate around. You can it's so easy to look at the date ranges and say what time frame do you want to look at audits from, today, the last week, the last quarter, the last year. You can look at all the audits, you can look at one audit, you can look at one ward, you can look at a division. It's so easy to sort of move around the system and to be able to see what your audit data is. But also what we really like is that we were able to develop our audit tools in conjunction with Meg, but also that we haven't got a limited capacity in terms of the areas. So if we have a new clinical area that's developed, we haven't got to just approach yourselves and say, oh, can we add this ward on? It's like within our capacity to do that. So that's really helpful, because quite a lot of the time different areas are changing their function, different departments, and they're required to be included in the audit program. So having that flexibility in where we want to audit is really, really helpful. I mean, I think we piloted it for quite a period of time, and straight away, as soon as we started using it, we thought, yeah, this is for us. It just ticked all the boxes in terms of how we want to deliver our audit program and to cascade the information out there. So we didn't at that time formally trial any other audit software that was on the market, but Tendable was in use at the trust, and we did have visibility of some of the audits that were on there. And then for a period of time last year, we due to financial constraints, we reduced some of our audit capacity on Meg and moved some of it across to Tendable, looking at urinary catheters, cannula care, commode, cleanliness. And straight away we had a limiting factor that the number of departments on Tendable was limited, and so we could only audit areas that were on Tendable, and that kind of paralysed our audit program, because we couldn't provide assurance in departments that weren't included on Tendable. So very quickly I escalated it internally, and then we approached Meg, and we went back onto Meg for the small collection of audits. We've always maintained our annual IPC audit program via Meg, but those additional audits and moved to Tendable briefly, and then we moved back to Meg, and we're able to deliver the audit program we want to deliver now using Meg. The one that stands out immediately is your first impression. So as soon as you log in and see the dashboard, it hits you, and it's a positive system to navigate around, and it's very slick to navigate around. It's not clunky, it doesn't take ages to load up, and as I say, you can flex what you want to look at, which audits, which areas. So it was that, and then it was the simplicity of actually undertaking the audit, getting a tablet and then launching the app and then just doing the audit. It's so slick to use it, to use the audit tool. As I say, just ticked all the boxes for us. Absolutely, the dashboard, as soon as you open it up, it just the way it's illustrated and put together, and the way you can look at the overall summary of an audit, and also look at the granular data very quickly, and you can see in an individual area where the compliance is good or where it might not be so good. To be able to flex so quickly around the system using the dashboard, that's the big selling point for me in terms of its functionality. It was quite easy, really, because transition across, because the system we had was so manual and paper-based, to move over to the automated sort of system using Meg straight away, it just saved so much time for us in terms of the whole audit process. So it was a very easy transition. Obviously, I think one of the challenges was the communication in terms of telling other people around the organisation what audit tool we were using now, and then educating other users on it. So obviously myself and my relatively small team had training on how to use the audit tool. So I think it was Donald, bless him, who gave us all the training on that 2 or 3 years ago now, and he showed us how to use it and how to navigate around it. So probably the only other obstacle beyond that was then us showing others how to use it. I mean, the system's so straightforward to use. It's very easy to tell others how to use the system. But yeah, I suppose if we were going to roll it out again, we'd probably need additional help from yourselves in terms of showcasing it and educating others in how to use the system and navigate it. But I'd say it wasn't a big deal being able to show people how to use it. I would say we've been able to deliver our audit program more effectively and more efficiently. In years gone by, when we would try and do an annual audit program, go into each department, having a big IPC audit once a year, we wouldn't always complete that program within the year, purely because of the capacity in the team wasn't what it is now. But due to the time the audit process took, that was an inhibiting factor in trying to deliver our audit program. So because using Meg, it's so much more slicker. But the last 2 years, we've been able to deliver our annual audit program within the first 3 quarters. So we leave a whole quarter at the end of the year to catch up or re-audit if we need to. So it's definitely improved that, as I say, in terms of delivering our audit program. And then in terms of expanding on our audit program as well, it enabled us to do that more effectively. We didn't have any bespoke tools to deliver any other audits. We very much, it was a pen and paper, typing all data into a Microsoft Excel document and then emailing things out like that. So having the Meg tool for us to do other spot checks like commode and IV line checks and urinary catheters has enabled us to consistently audit those practice areas of practice. And also we developed our own enhanced monitoring tool within Meg in conjunction with yourselves. So if we have an area where there's any department where we want to give a bit more focus on measuring the IPC standards, we do an enhanced monitoring audit in that area. So it's enabled us to have that consistent approach when we're looking to, as I say, keep an eye on any area of concern, really, any department. And something we've definitely seen, we've seen big improvements in commode cleanliness since we started using the Meg audit tool to monitor commode cleanliness, and that's because we've sustained the audit program, but also because others have got visibility of the audit data as well via Meg. That's enabled us to achieve that. There's still some work to go in terms of urinary catheter and IV line care, but again, the audit tool in Meg gives us that visibility. We can see what aspects it is that areas need to focus on for improvement, and also it's helped us to refocus on hand hygiene compliance, and if anything, we've given ourselves more work because wards used to self-monitor in terms of hand hygiene compliance, but we weren't convinced that the data we were getting was that robust, and lots of areas were reporting very high levels of compliance, when anecdotally that's not always what you see in clinical practice. So because we had Meg, we were able to take on the hand hygiene monitoring as a team. So it's a bit of an undertaking, but the fact that we had the tool, it made it possible for us to take on hand hygiene compliance monitoring, which the IPC team have done since October. And straight away there was a dip in the compliance standards. So I think we were getting a better representation of what the true hand hygiene compliance picture was. And then, as I say, using Meg, it gives us that real clear focus on what are the areas that we need to focus on in terms of to drive up compliance. I'm very much optimistic that when the subscription for Tendable is completed, it finishes this year, that the Trust will choose to adopt Meg more broadly for a lot of its other catalogue of audits. Obviously, that's not my decision. That's above me to make that decision. But I'd be very hopeful that that's what the Trust choose to do, and I think it'll just help embed our audit program and the wider audit program better. It'll give us a more robust audit program more broadly, because we've already effectively demonstrated what it can achieve in terms of delivering an audit program. So we should be able to, by broadening it out and using Meg for all our other audits, hopefully that the Trust can deliver a more robust audit program more widely. And I also think if other organisations can adopt Meg as well, you can then have that comparison between organisations as well. If you're using the same audit tool, then you can benchmark yourself against other organisations. And I had a network meeting on Friday with my IPC leads at Mid Cheshire and East Cheshire and Wirral, and I was demonstrating them the Meg audit tool and how it looked on the dashboard. So I've shared their contact details with Helga, and they were quite happy to contact her and see if they could have a look at Meg with her. And in terms of supporting our wider infection prevention goals, again, it just allows us to benchmark where we're at in terms of our practice standards, and that's so important in terms of providing assurance against our board assurance framework. If we need to evidence, the standard of care that we're delivering, we can effectively do that. We can just open up the Meg audit software and showcase what standards we've got and what standards we're delivering. So it's integral to our future, I would say.